Well, it's National Men's Health Week, and the goal to heighten the awareness of preventable health problems and encourage early detection and treatment. And this includes dental care. Joining me is Dr. Melvin Pierson with Pierson Dental Associates to tell us why men have a tendency to forget or skip good dental hygiene. Dr. Mel, good to see you.
Good to be seen.
Always a pleasure. I know that's right. All right, let's talk about the fellas for a minute. Why is it we don't see our doctors on the average as much as we should, and that includes dentistry as well?
It's just part of being a guy. We as a whole do not like to go to the dentist, do not like to go to the doctor. I have a lot of patients who have a male patient will come in, and I'll say, why are you here? They'll say, because my wife told me to come.
How about that?
So it's a lot of neglect, and it leads to a lot of poor oral health. I mean, some statistics from the Academy of General Dentistry is that the average man brushes their teeth twice a day when they should be brushing it 3 to 4 times a day.
3 to 4 times a day?
3 to 4 times a day.
Especially after meals?
Especially after meals. If you're like me, you're eating more meals a day, so you're brushing more a day. Also, with that poor oral hygiene of brushing twice a day, if that man lives to 72 years old, he's expected to lose 5 teeth. And if he's a smoker, he's going to lose 10 to 12 teeth at 72 years by the lack of the dental visits.
Let's talk about periodontal disease. That can lead to heart disease as well. Why?
Periodontal disease is also linked to the poor oral health, first of all.
Okay, right.
So men are very common with periodontal disease. The problem is they don't know they have it because they don't visit the dentist. When they do find out they have it, it's imperative to keep that bacteria off the teeth because that bacteria gets into the bloodstream. And when it gets into the bloodstream, it accumulates on the valves of the heart. So I tell the patients, if you don't come to the dentist for your teeth, do it for your heart. Because there have been links that directly link periodontal disease to heart disease.
You were talking about brushing a few seconds ago, and I remember my dentist told me years ago, brushing your gums is important as well. And why is that?
Because you want to brush the gums to keep the gums, again, help free from disease. It's not just the teeth, it's the gums, it's between the teeth, it's the tongue, it's the roof of the mouth. All of these places house bacteria. So you want to take the time and brush all of this.
Give us some oral health tips as we get ready to close the segment. Break it down for us.
Well, breaking it down, again, based on the Academy of General Dentistry, they want you to brush 3 to 4 times a day. They want you to use these particular items here. If you can't brush or floss, they want you to rinse your mouth with a fluoridated water. If you can't do that, chew a sugar-free gum, which is has xylitol and sorbitol in it. These different flosses, they come in different packages. Some we could actually make on a keychain for you so you won't forget. We have some of these items that's like a toothpick that'll help with your flossing. Another big thing for men is playing sports. They think by being active and working in the gym is helping their teeth, but when you watch a guy work out, he's clenching his teeth.
Right.
So we make these specialized sports guard or mouth guards for that. As I mentioned to you before, LeBron James wear this. You know, it may help your jump shot.
So if I wear those, I can play like LeBron James?
You'll have healthy teeth like LeBron James. And then some of the other ones we make, if due to stress, a lot of men tend to grind their teeth. So we want to make the occlusal guards too. But so all of these things, again, start with the dentist. They start with the 2 times a year minimum visit, the brushing, the flossing. This is Men's Health Month. They need to come in.
And whenever you come in, no pun intended, we always smile. Thank you, Doctor.
Thank you very much.
We appreciate it. We're going to take a short break. Eyewitness News on the CW comes back right after this. Good morning.